We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. What athletes truly have the strongest spines? Weightlifters and powerlifters. Wolff's Law states that bones will develop their strength based on the appropriate demand that you apply to them over time. Big difference between pain and achiness. Core strength is not necessarily correlated with low back pain. Just because your core is strong doesn't mean you're not going to have low back pain. Deadlifts should be more of a health prescription. Rather than something to avoid, it should be something that you're building back into. The spine needs stress the same way over and over again to be able to develop longevity. And loading your spine over and over, exposing it to the elements, into resistance, into load appropriately over time is what really creates resilient spines. Today we are talking about one of my favorite topics, and it is called the deadlift dilemma. The deadlift has a lot of negative connotations to it. People think that deadlifts is bad for your back. Ultimately, deadlifts is the best thing that you can do for your spine. And I'll take it to my grave. The reason why deadlifts are so beneficial for your spine is because it helps your spine be very resilient. You know, my daughter came to me one day and she showed me her calluses on her hands. And she said, I was doing the monkey bars all summer, and one of my friends came and did the monkey bars with me, and she tore her hands and ended up bleeding. She said, I've been doing monkey bars all year, and I've developed this thick callus on my hands. And it made me think a lot about our bodies and how our bodies are very resilient. And our spines are meant to be loaded if loaded appropriately. A term that I like to use in the clinic is the role of the spine is to keep the line. Meaning the line is the spine should stay stiff. It doesn't matter if it's flexed or straight, as long as it stays stiff through heavy loads. The spine is meant to articulate and bend really well when picking up little objects off the floor. But the minute we're picking up a big load or doing a lot of repetition of load, the way we lift is super critical. So I'm going to go over a few myths that we have out in the community, and our goal is to abolish these myths so that way you know what's actually truth and what's actually not. So the first one is disc herniations require a lot of treatment and generally don't heal well. Symptomatic lumbar disc herniations are short-lived. 85 to 90% of cases will resolve within 6 to 12 weeks. So if you've had a disc herniation or you feel like you've had, a good rule of thumb is get with a great physical therapist or a healthcare provider that can help walk you through that process. 6 to 12 weeks without substantial medical intervention. That's great, right? And knowing that is really helpful because a lot of people think if they have a disc herniation, they have to immediately go to surgery. I've had hundreds of patients with low back pain, and maybe even close to 1,000 now. But ultimately, some of my most severe cases, I'll kind of clump together, but these cases come in, which is severe, 10 out of 10 pain. Leg symptoms, we call those radicular symptoms if they go down your leg. They start at your spine, but then they create symptoms going down your leg. The farther they are down your leg, the worse the compression typically is at the spine. And there's really two parameters that we think about, two major, is there pressure from a disc pushing on a nerve, or is there a chemical component that's causing a nerve irritation? The chemical component can happen from a disc leaking this chemical. Say there's compression on that disc for a prolonged period of time. Maybe you were out laying sod in your yard and there was a lot of repetition with a lot of load and it compressed the disc, and there's a chemical leakage that happens prior to a disc herniation. And that leakage can be very toxic to a nerve. And that nerve can be really irritated and it can send signals. And those signals can go all the way down your leg, all the way to the foot. The farther that they travel down the leg, the more compression or irritation at the spine. It doesn't mean it always starts at the spine, but most likely it starts at the spine and goes down. Sometimes it can start in the hip as well. But having a good diagnostic clinician help you determine where it starts is really helpful for treatment. So I always think diagnose, then prescribe. I've had physicians reach out to me periodically saying, can you provide me with a list of exercises that I can provide my patients with low back pain? And I was just thinking like, what really do we need here? First, I would never give exercises. I would never give medication without knowing the diagnosis first. And the same thing is with exercise when you're having pain. You have pain in your spine. It's really important to match the appropriate exercises with the actual condition. If you just YouTube back pain, you can get all kinds of exercises. And sometimes even in the clinic, even under specialty care, I can give the wrong exercise to a patient. And that's why it's really important for me to follow up with them to know, is that exercise creating the response that we need? And if it isn't, we're changing it, because sometimes we give the exercises and actually increases your pain. And that's why it's so important to do those follow-ups. The next myth I want to abolish is lifting heavy weight is bad for your back. There's another article from Fisher et al. In 2021. But exercise program, including deadlifts, are clinically effective for treatment of low back pain for both pain scores and functional outcome measures. So pretty much how strong your back is more correlated with less back pain. No one ever had more back pain from having a stronger back. What they really have back pain from, if they do have a really strong spine, is that they can't turn off the muscles. The muscles are always tense and always on. So we teach those people to relax the muscles and to be able to contract the muscles and to appropriately use them. What athletes truly have the strongest spines? This is really interesting to me. Weightlifters and powerlifters have the thickest and most resilient intervertebral disc. We go back to my daughter with her calluses. How do you develop really strong skin on your hands? There's a law that we haven't gone over, but it's called Wolff's Law. Wolff's Law states that bones will develop their strength based on the appropriate demand that you apply to them over time. So there's a Liftmore study that's been put out that shows that women with osteoporosis can actually reverse osteoporosis, and that is weak bones. Osteoporosis is the term for weak bones, and weak bones can actually be reversed by appropriate lifting weight over time. If you lift too much, people get hurt. If you don't lift enough, they don't increase their capacity. But actually, if you with a DEXA scan, it measures bone density and actually can reverse osteoporosis and osteopenia. Wolff's Law is the same with any other kind of tissue. You know, the meniscus in your knee. Right? It shows with runners. Recreational runners have the thickest meniscus in their knees. Why? Because it's absorption. It's appropriate absorption. You know, and the actual competitive runners have the most amount of knee arthritis. So overdoing it is not good either. It's all about appropriate load over time. Gymnasts, evidence suggests that gymnasts have the most robust spinal disc and increased flexibility, though they have risk for overuse injuries, right? So ultimately, having load to your spine, appropriate load over time, is what creates resilient spines. That's really what you want, is to add appropriate load over time. Overdoing it or underdoing it can cause issues, and we want to appropriately load over time. Rugby and football players. Research indicates that rugby and football players have higher spinal density and thicker vertebral end plates, which is linked to disc health. Right, so we've talked about all these different types of athletes that have really robust spines. And how do they do that? They do it by consistently loading their spine. So why do they get hurt? You have these athletes that get hurt. Why do they get hurt? Mostly because they're pushing the limits. They're getting to their 1 rep max. They're always pushing the next level. And that's how they get hurt. It's because they're pushing their body to failure. It's not because the gymnasts just naturally get hurt more. It's because they're pushing the limitations of what their body is capable of doing. Ultimately, if gymnasts just didn't push to that level, they wouldn't get hurt at that level. Same thing with weightlifters. They're pushing to the ultimate extreme of what they're capable of doing. And that's something to think about as you are lifting and going back into deadlifts. Do it gradually expose. If you go back to the calluses with my daughter again, do you develop calluses overnight, or do you develop them over time? You know, you gradually expose your hands over and over. What happens if you add too much load? You can develop blisters. You can tear, right? If you don't add appropriate or enough load, you'll never develop the calluses, right? But the idea is if you're developing calluses on your hand or if you're loading your spine is to make it hurt a little bit, not pain, but make it ache. Right? You're loading the muscles. You're getting the muscles fatiguing. They should be a little bit sore after you're doing your exercise, but not to pain level. There's a big difference between pain and achiness. The pain is typically it's stabbing. It's something that you can rate on a 1 to 10 scale. Muscle fatigue or muscle DOMS, delayed onset muscle soreness, it can happen from microfiber tears in your muscles, which is appropriate. That's how you build up muscle, is you want to actually break down the muscle, and then over time, the body heals it, and they get bigger. They hypertrophy. But if you don't appropriately load it, then it can't hypertrophy. But you want those muscles to be a little sore for up to 24 to 48 hours. If it's beyond 48 hours, then you know you push too hard. And that's a good parameter to tell if you're appropriately progressing. But you never want to work in pain. A few other things to think about as you are deadlifting. Your hip mobility is critical. If you have a very stiff, say, hip external rotation, if you cross your leg on the one side and you have less external rotation, your knee doesn't fall towards the ground more, or say it's not symmetrical to the other side, it's something you might want to work on or look at. Because when you squat or when you deadlift, you can have a hip rotational component that can load your low back. I see it all the time in the clinic. And we get that stabilization going in the hip, and we get that symmetrical mobility on each side, and then start loading over time, and it takes away their back pain. Another component is their upper back. You know, if you have back pain, not necessarily with deadlifts, but you have back pain on a regular basis, your upper back is super stiff. Your upper back should be very mobile and your low back should be very stable. Creating that balance is really important. But if you have a very stiff upper back, it will demand more load through your low back. So we want good symmetry of good mobility through your upper spine and good stability through your lower spine. Core strength is not necessarily correlated with low back pain. Just because your core is strong doesn't mean you're not going to have low back pain. I've seen people that have ridiculously strong core muscles but have a lot of back pain. And a lot of it's your ability to brace. It could be a bracing technique. Maybe as you're lifting heavy loads, you're not able to manage pressure within your intra-abdominal cavity. So your breathing mechanics aren't done right. A lot of terms that we use in the clinic is breathe in to prepare and breathe out with effort. So as you're lifting a heavy load, as you're say we're deadlifting as an example, you're going to breathe in as you go down, and then you're going to breathe out as you come up. If you're lifting super heavy, typically over your 80% of your 1 minute max, we also teach people to hold. So they're going to breathe in as they're going down and then hold their breath and tighten up as they pull the bar up. And that's a different technique that we use for different lifting mechanics. But that's a good thing to think about. Another thing to think about is the faults that we see in deadlifts. So I want to go over a few key mechanics with deadlifts to make sure people are applying these appropriately. The actual form of the deadlift is critical to loading the spine appropriately. So number 1, lat engagement. So latissimus dorsi is a muscle, and if you Google that muscle, you can see a picture of it. And that picture, it will show you how it crosses almost the entire spine. So as you engage that muscle, as you squeeze your armpits, the cue that we'll use is I want you to imagine you have oranges between your armpits, and I want you to squeeze those oranges, or imagine someone tickling you from your back. In your armpits, squeeze those muscles so it tenses everything up, and it will keep tension through your whole spine. So lat engagement is really critical. Number 2 is you want to have a hip hinge. Some people will deadlift in a squat position. So you actually are in a hip hinge position to start. Starting position is key. So your hips are a little higher in a deadlift than in a squat position. And then your chest is high. So you're looking forward rather than looking at the ground. Number 3 is that you're taking the slack out of the bar. You don't want to do a quick jerk out of the bar. You want to slowly build up tension. So you take the slack out of the bar before you lift all the way up. Number 4 is you pull your hips towards the bar. Too many people will lift with their spine first and then push with their legs second. It's actually a movement that happens simultaneously. And then you pull your hips forward towards the bar as you stand tall. And then the last one is to release the hips as you go back down. So you release the hips, the bar slides straight down your thighs, and then you bend the knees once it passes your knees to get it to the ground. So those are the key components to lifting really well. And that's how we build resilient humans, is teaching the spine to load appropriately over time. Because if you do that, your disc health increases. Your spinal discs get thicker, and you want thicker spinal disc, right? There's a few studies that I'm thinking about. I don't remember the titles of them, but the discs can withstand tens of thousands of pounds if loaded appropriately. If they're loaded inappropriately, they don't withstand very much. So bracing the spine, keeping it super stiff, is critical to the deadlift position. But I hope this really emphasizes the importance of loading your spine over time. I want to go over one last key component of what it does. There's nothing that helps your back health more than confidence. If you lift a heavy load consistently off the ground, lifting a barbell will do nothing more than make you feel super confident about yourself. Lift a heavy load off of the ground, and confidence is directly correlated with back pain, or I guess lack of confidence. The more confident you are with your spine health, the less likely you are to have pain. So it actually decreases fear avoidance. A lot of people think their spine is fragile. Like there's some jelly donut in my spine. You'll see a lot of people describe the spinal disc as a jelly donut. That is not true. It's not like a jelly donut at all. I dissected human bodies and saw what they were firsthand. I haven't seen them in a live human, right? If I'm, doing a spinal surgery, but I've heard they're very similar. Essentially, when they cut out those, say you had a bulging disc, when they cut those out, that disc tissue is really, really strong, and they have to use really strong cutters and pliers to actually cut around that tissue. And it's really interesting because a lot of people think it's just a jelly donut. They go and trim in with a pair of little scissors. That's not the case. When they do a microdiscectomy, what they do is they cut off part of the bone, resect part of the ligament or pull it apart, and then they get down to that tissue where the disc is, and then they have to go in with these little chompers and chomp at the disc to remove it so it's not pushing into the nerve. And is what happens when you do that microdiscectomy, you lose disc height, which over years as you age, you actually lose disc height as well. But what's interesting with discs is as you sleep, they reabsorb with water. And you want water in your discs because they develop, they create disc height. The less disc height you have, the less absorption capabilities you have. So that's why hydration is important to back health as well. It's because you fill those discs with a lot of fluid, which creates nice absorption. It's essentially like suspension for your spine. So when you sleep, your body reabsorbs all of that moisture or all of that water, and then it creates more suspension for your body. In a disc of someone that's deceased or a cadaver, it's the same thing. I remember taking out a disc and taking a scalpel and pushing into it. And it took everything I could to push that scalpel through. And the material inside, it's called the nucleus pulposus, that jelly that a lot of people refer to, is nothing like jelly. It is like a thick tar substance, and it's hard to maneuver. It's really tacky, it's stiff. It does not just squirt out like a jelly donut. So if you've heard that terminology, that's the last thing that your spinal discs are. It is very tough. The outside of the disc is called tough mother in Latin, and it's super, super durable, super, super strong, and the fibers are very, very robust. So something to think about. As you're lifting heavy, it helps you develop confidence. So really, deadlifts should be more of a health prescription. Rather than something to avoid, it should be something that you're building back into. And there's multiple ways to modify the deadlift. In clinic, we're doing rehab with people that have pain. Our goal is to reduce and stabilize their pain before going back into these movements. So we might work on this progression of reducing and stabilizing pain. We might use techniques like dry needling, maybe some Theragun, maybe some soft tissue work, or kind of like massage techniques to calm that down. We might use cupping, we might use heat, we might use some ice. There's different techniques that we can use, and how people respond is really important. But use those techniques to calm people down, and then gradually work into pelvic movements and upper spine movements to introduce blood flow to promote that healing process. And then we gradually work into these movements again, these functional movements. We might start with a bridge. That's a modified deadlift, laying on your back and bridging up. That's a hip hinge movement. And then we might work on some bracing techniques to stabilize. And then we might work in standing and start working on some pelvic tilts. And then gradually work into some bracing with resistance. And then work on some good mornings where you're hip hinging again. But we're gradually exposing your spine over movement over time. Adding load. and then adding load consistently as there's no pain. But we never work people into pain. The spine needs stress the same way over and over again to be able to develop longevity. And that's super critical. So a few things in summary. The most important thing that you can do for spinal health is a deadlift, and loading your spine over and over, exposing it to the elements and to resistance and to load appropriately over time is what really creates resilient spines. Not doing deadlifts is really like saying, oh, I sprained my ankle, therefore I'm not walking again. No one would ever say that. If you sprain your ankle, I hope you get back to walking again. And same thing with your back. If you hurt your back deadlifting, or you hurt your back in general, saying that you're never going to deadlift again is like saying you're never going to walk again after having an ankle sprain. It's super critical that you have graded exposure, that you have this natural progression. You can't just go from having back pain to jumping into deadlifts again. That you're just going to re-injure that. So don't follow that terminology. Have a good expert guide you through that process and help you through getting back to graded exposure over time. In summary, deadlifts are not the enemy. Fear, poor form, and misinformation can all be very damaging for your health. Belief systems in back health is super critical. If you believe it's going to hurt you, it most likely will hurt you, especially if you had recurring back pain in the past. So if you need help, reach out to us. We can answer your questions. We can guide you to resources. Find a great therapist. If you've been to a PT before and it hasn't worked, find another one. Sometimes things just don't work out. But I will say that deadlifts is one of the most powerful techniques that you can use for your spine to get it back to full health and build resilience. So I hope that's helpful. I hope you enjoyed this episode, and go out there and deadlift.